This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. Welcome back to the latest episode of the Best Health Podcast. Justin Gomez here from Wake Forest Baptist Health, talking with another really great special guest today, Dr. Stephen Scoggin. He's the Associate Vice President of Behavioral Health and the Interim Chair for the Department of Psychiatry and Behavioral Medicine through Wake Forest Baptist Health, and also an Assistant Professor with the Department of Psychiatry and Behavioral Medicine. So we're going to talk today about some of the stress and anxiety factors around COVID-19 and coronavirus, and just how that might be impacting our lives. Welcome, Dr. Scoggin. How are you doing, sir?
It's good to be here, Justin. Thank you for having me.
Absolutely. So Dr. Scoggin, he is the Associate Vice President of Behavioral Health and the Interim Chair for the Department of Psychiatry and Behavioral Medicine here at Wake Forest Baptist Health. So he has a lot of insight and wisdom to impart on us as we talk about, the stress and anxiety with finding our new normal with COVID-19 and coronavirus. So thank you for being here, Dr. Scoggin. And before we get started, if you just want to give a brief welcome and introduction, a little bit about yourself and what your day-to-day I won't say normal routine, because none of us have had a normal routine lately, but
Sure.
kind of what your day-to-day has been like lately.
Well, as Justin said, I've been here with the medical center in actually a number of roles for the past 19 years here in the Department of Psychiatry. My background is training actually as a psychotherapist. So that's what I spent a lot of my time doing in my career until I got into administration. And it might be interesting to the listeners that I'm also ordained clergy, theologically trained, have a divinity degree, and have actually pastored churches too. So I bring kind of a multi-perspective, a biopsychosocial, spiritual perspective to the work I do on a day-to-day basis. Concerning the day-to-day recently, there's been no day the same. We're trying to do the adequate preparedness that we know to do for our patients and folks in the community who we know this is going to heighten their distress. We as providers are trying to manage our own stress and anxiety so that we can bring a sense of calm to those we're trying to serve, but we're human as well, and so we're having to manage our own stress and anxiety as well as providers, kind of, if you will, walking the talk and practicing what we try to convey to our patients on a daily basis.
Yeah, that's a great point, Dr. Scoggin. And before I dive in here, I just want to remind people listening, just to make everyone aware that this podcast, along with all of our other COVID-19 coronavirus-related podcasts, will be available on our coronavirus resource page on our website. So anyone can go to wakehealth.edu/coronavirus, and they'll find a plethora of information about, clinic updates, visitor restrictions, symptoms, when to get tested, how to get tested, plus a lot of additional resources such as these podcasts and FAQs and all kinds of really good and reliable information. So we'll add this podcast to that page, and it'll be up there for people to use. So I'm glad you brought up the multifaceted, multidimensional approach. I guess as a baseline, if you want to talk to us about what do we do when we feel the stress and anxiety, when we have a kind of an external factor change so much of our lives, such as COVID-19. I hear that, humans, we like some sort of structure and routine, and that's been turned upside down lately. So what is our body emotionally, physically, spiritually, what is happening to us when stress is going on in our bodies? What's taking place?
It's a great question, Justin. Let me attempt here to kind of break it down and normalize stress, and then move to this period we're in, which is a little excessive and creating more stress for all of us.
Mm-hmm.
So stress affects you every day. You may notice symptoms of stress when you discipline your kids, you having a busy day at work, you're managing your finances, or you're coping with a challenging relationship. Stress is everywhere, and while a little stress is okay, some stress is actually beneficial. Too much stress can wear you down and make you sick, both mentally and physically. So the first kind of, if you will, step to manage stress, you can't control, but you certainly can manage stress, is to know the symptoms of stress. But before we jump in there, Justin, let's look at what is it? What are we talking about here? Stress is the body's reaction to harmful situations.
Mm-hmm.
Situations that may be real or perceived, or if we could say imagined. So we're doing a lot of, if you will, anticipating, imagining what this COVID-19 outbreak may mean to us, both physically, financially, emotionally, and spiritually.
Sure.
So when you feel threatened, a chemical reaction occurs in your body that allows you to act in a way to prevent injury. That's what happens in your body. A chemical reaction is released, specifically adrenaline and cortisol.
Mm-hmm.
And we call this the fight. Your body is either preparing to fight or flee, to hunker down or to fight. During a stress response, and I've actually had this today with some situations, your heart rate can increase, your breathing kind of quickens, you might get short breath, your muscles tighten up, your blood pressure can rise because you're getting ready to act on something. So that's kind of what stress is. It's this reaction in the body where a chemical reaction takes place, hormones, adrenaline and cortisol are released, and they kind of rev you up, getting you ready for what's getting ready to happen. If you stay in that state, Justin, you get sick. What do I mean by, well, you can get physically sick, coronary artery disease, stroke, digestive issues, just to name a few.
Yeah. I've heard of, I've been talking with a couple of my friends, and, more than one have said they haven't been getting great sleep lately just because of this stress, and some of it might be realized, and some of it we might not realize necessarily is happening in our body. Is that right? Some of it might kind of be under the surface of the water a little bit.
Yeah, that's why I was trying to name what these normal reactions to stress are in your body. So people can, if they start feeling like their breath is short and they may have a cough, they think, oh my gosh, I may have COVID-19. It could just be that you're stressed.
Yeah, exactly. That's a good point. So, you mentioned fight or flight is kind of what maybe some of us have heard over the years of how we react. So I guess some of us feel like we have to, when the stress is happening, we have to do something. We have to react in some way. So in your experience in the years that you've helped people, what are some of the ways that they've shared with you that they react? And what have you shared with them about how they can react in there's probably healthy ways to react and maybe not so healthy ways to react.
Well, let's just talk about ways that people respond to stress, that we won't put a value on them if they're good or bad. They're just normal ways emotionally that we respond to this sense of feeling threatened. Our body goes on high alert, but emotionally, what might happen? Well, we might feel a little more agitated. We're kind of short with those around us, or more frustrated, or we're a little more moody. We might start feeling a little overwhelmed, like we're losing control. We might have some difficulty relaxing. So you mentioned sleep interruption. Very typical. Difficulty relaxing, quieting. You can't quiet your mind. You can't think straight. You start feeling kind of bad about yourself, low self-esteem. You feel lonely, worthless. And then if this persists, you can feel depressed. Again, I want to normalize that these are normal responses to stress, which we call anxiety. Now, to the other, I think part of your question is maybe what can one do when they start feeling these things in their body and their mind, and they start noticing that they're reacting in kind of agitated, frustrated, hopeless ways. What can one do? Well, first thing that I would name is acknowledge that you feel the way you do.
Yeah.
A psychiatrist once said, Dr. Carl Jung, what we resist persists, which is another way of saying what we try not to feel takes on a life of its own. It persists. So just naming that you're scared, that you're uncertain, that you're afraid of a variety of things, losing your job, your retirement, whatever it is that's scaring you, to name that, because this is a time of great uncertainty for all of us. But what I would encourage folks to think about, that what is going on externally, don't confuse that sense of uncertainty, which we all have, with what might be true of what's going on internally within you. So there's what's going on externally, COVID-19. But what do we actually have influence over? So Dr. Stephen Covey, who actually taught us a lot about leadership, known for his book, The 7 Habits of Highly Effective People, he used to talk about it this way. We have two circles we live within on any given day. One is the circle of concern. It's all the things, Justin, that concern you and me: world hunger, the COVID-19 virus, our finances, our kids being out of school. We could go on and on with those concerns. And then there's what he calls the second circle, the circle of influence. What are those things that you have influence over? The more you can exercise your influence muscle, like doing something, the more it can decrease all the concerns that actually in a time like this could consume and overwhelm someone. Some very specific things I'd suggest that we all consider during this time of uncertainty is we're getting bombarded by the media, whose intent is good, to keep us well informed. I'm telling everyone, pick 1 or 2 trusted media outlets, view them in the morning and in the evening, but not right before you go to bed, at least 2 hours before you go to bed. Get caught up, 15, 30 minutes max, and then shut down from the media. Infomania can be very stressful right now. We get a lot of conflicting reports and opinions about what's going to happen. So take control over ingesting the media that you're ingesting right now.
That's great advice.
A second thing I would suggest is try to stay focused as much as your mind will allow you in right now, this moment, the here and now. And you might ask, and this may sound counterintuitive, what not am I losing from this, but what could I actually gain from this uncertainty and unusual time? We have, if we are going to be sheltering in here in Forsyth County, I'm told very quickly our mayor and other county officials are going to invite us to shelter in. What might we gain from that? Like extra time with our family, opportunities to make our life better, we're going to have time maybe to learn something new that we haven't had the time to do because of our work lives. I think it's a two-edged sword from anticipating what may happen to try to stay focused just in the here and now. The present moment is really all we have, and to look at what the opportunities are for us in this unusual time that we're living in.
Yeah, so that's interesting. So you're saying just to try and stay actual cognizant of what our mind is working on, and I guess it can so easily drift off to 3 days from now, a week from now, a month from now, and without us maybe even realizing that we're doing that, right?
Yeah, and all of us are thinking about what I call the what ifs. We're all saying, what if this, what if that?
Yeah.
Some of us bind, and I'm one that I count myself in this group. I kind of try to bind my anxiety and stress by planning as if I had some control over what's going to happen in the next few days or months. But that helps me. Helps me feel like I'm in control. But when people live in the what if world, what if this, what if I lose my job, what if I can't go back to work, there's an endless list of what ifs. I would say try to ask yourself, then what? If you just stay in what if and you don't move cognitively to then what, you're just staying in this perceived world of anxiety and stress versus, okay, if I lose my job, then here's what I'm going to do.
Sure. Well, that, brings up a really interesting point, Dr. Scoggin, as we're talking through, how to stay focused and manage the stress and anxiety. One thing that you just mentioned was this shelter-in-place possibility that already lots of Americans are dealing with, and here locally we might be dealing with as well. So, social distancing doesn't mean actually isolating and not having any sort of communication with other human beings, right? That's you would encourage staying connected, wouldn't you?
Oh, absolutely. We're social animals. We're wired to be connected, and it's inviting us to stay connected in some new and creative ways. Can we stay connected in digital platforms and find ways to connect emotionally and intimately over a digital platform? I can tell you, I have a group of friends that I raised my children with, 4 other couples. We got on a group FaceTime and just were with one another on Sunday night, and it was so good for us because we laughed and released some endorphins and got our minds off things that we said, yeah, we need to do this on a regular basis during this time. So, yeah, when you're social distancing, as you well said, Justin, does not mean socially isolating yourself from folks.
Yeah, if you start kind of down the cycle of just being off by yourself and not having other human interaction of any kind, that lead to some issues that could lead to depression or anxiety. Could that kind of fuel that type of thinking?
Yeah, absolutely. When we're helping folks who are struggling with depression in, if you will, normal times, we really encourage them to stay connected to those social supports, because as you lose perspective when you're depressed, you're not motivated sometimes to want to be around other folks. But the key is that they stay connected even if they don't want to, because many of our elderly who could get pretty socially isolated during this time, and we know just the social connection would be extremely helpful to them.
Yeah, that's a great point. I do want to also just touch base real quick, as we're talking about what this new normal looks like for all of us, with work being adjusted, school being adjusted for kids, our social interactions being adjusted. There's different personality types. There's type A, there's type B, there's this, the Enneagrams now of what type are you? And, I think some personality types, they all have their benefits, but some are traditionally, I guess, maybe less flexible than others, or less kind of go with the flow. Can you give us just your thoughts on how we should be flexible or adaptable during this very unique time, and not I get one of my old coaches used to say, don't sweat the little stuff.
Yeah. Well, easier said than done.
Yes.
I would name, and I think what you're alluding to, Justin, all of us are different.
Yeah.
And we all have different styles about how we manage stress and anxiety. And so all of us are different. What I would say is, as we enter into some uncertain times, we need to stay grounded in the things that we know about ourselves and those around us. We've already talked about the social. I'm getting more into some, if you will, coping strategies and how to better manage this. I just, and I do this regularly anyway, but I certainly find myself doing it more on an hourly basis. It's just really deep diaphragmatic breathing. Diaphragmatic's a fancy word to say, it's really saying breathe from your belly. Take deep breaths regularly and often. You say, well, that sounds like a very simple thing to do. You'd be surprised if you take very deep diaphragmatic breaths, hold it and let it out, how it clears your brain and mind. It has a neurological effect. So I would say deep often and deeply during this time.
Okay. And then, you mentioned earlier that you also do have a theological background and or ordained. So, people that have practicing faith or participate in a faith group or community here, you would probably just encourage them to stay connected with that faith community.
Yeah, to stay grounded in what feeds you spiritually.
Yeah.
I've participated this past Sunday in 2 virtual services over the internet, and found that to be actually enriching.
Yeah.
And comforting. So whatever your faith tradition is, I hope folks can draw from the deep well of faith that will help sustain them spiritually during a time like this. What's not atypical, what is sometimes the spiritual response when you're traveling through uncertain times, is you feel kind of pretty hopeless and your life has lost meaning. That's where spirituality and wonderful spiritual practices come in, of contemplative prayer, mindfulness, as well as just the more traditional things of scripture reading and prayer.
Yeah. Well, that's definitely encouraging. And as we wrap up, Dr. Scoggin, with this Best Health podcast, I know a lot of us can use, all the encouragement we can get right now. So this has been just so helpful, and I know you're really busy, so I appreciate you taking the time and talking with us today.
I have just a final word, Justin, to remind folks, we are very resilient people. Mm-hmm. We have been through natural disasters before. Mm-hmm. And actually epidemics before in this country. The H1N1 is the one that comes to mind most quickly in 2009. Mm-hmm. And that whatever you're feeling or thinking, remember that feelings and thoughts are transient. They're not necessarily reality. Feelings and thoughts come and go. So if you think of whatever gripping you right now, it's not permanent. It may feel permanent. It's going to stay with you, but those things are transient.
Yeah, that's a good word, Dr. Scoggin, and I appreciate that. And um, I hope our listeners appreciate the nuggets of wisdom you shared today with us. And I'll remind the listeners, if you need to reach out, we have a good network of providers and counselors on our website, wakehealth.edu. And also through Faith Health NC, or you can call 716-WAKE if you feel like you need to reach out to somebody. And also a reminder, just the COVID-19 updated information from Wake Forest Baptist Health can be found at wakehealth.edu/coronavirus, including all of these helpful podcasts, or what we hope are helpful podcasts for all the listeners out there. So, Dr. Scoggin, I know you've been busy, and I appreciate it. And hopefully we'll be able to catch up soon and talk about, kind of the next phase as we're moving out of this unique time.
Thank you for what you're doing through these podcasts, Justin, for our community. Thank you.
All right, sir, we appreciate it. And thanks to all the listeners out there for checking out this episode. And till we chat again, I encourage everyone to please be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu and follow us on social media. Wake Forest Baptist Health, the gold standard of healthcare.